Hi, it's Kristen here at UT Southwestern Medical Center. Thank you for joining our Facebook Live chat with Dr. Wayne Bowman on LASIK and LASIK eye surgery. So Dr. Bowman is a professor in the Department of Ophthalmology here at UT Southwestern. He specializes in corneal and external eye diseases and refractive surgery. He is also one of the first surgeons in the United States to gain experience in LASIK when the procedure was first being tested by the FDA back in the 90s. So we're extremely glad to have Dr. Bowman. As usual, don't forget to like and share our conversation. We want to get all those questions you've been dying to ask answered, and we will take as many as we can get to. We've got to be really careful about those very specific medical questions because of HIPAA privacy laws, but we will certainly do the best we can. So get those questions coming. And then thank you, Dr. Bowman, for joining us.
You're welcome. Glad to be here.
Yeah, so LASIK eye surgery. It's been around for a while, but can you tell us a little bit about what it is? What does it mean to have LASIK eye surgery?
Well, LASIK is a general term, and it's come to encompass any kind of refractive surgery where you're correcting somebody's vision. Generally, most commonly, it's done for people who are nearsighted. It can also treat astigmatism. It's available also for people that are farsighted. Occasionally, it's done to help people who have presbyopia, who've become older and are having trouble reading without glasses. Not as effective for that. You have to do a procedure called monovision with LASIK to correct that. Not everyone can do it. But it's been around now since the mid-90s. There have been many exciting advances and improvements in the procedure over the year. The lasers are better than ever. The machine to make the flap, which LASIK involves making a flap on the surface of the tissue to speed up the healing time and minimize pain, discomfort, and some of the potential side effects, and the machines to make the flap are much better. So it's really continues to be an exciting development in the field of ophthalmology.
Good to know. So I know we're starting to see some questions come in. Those are great. Keep them coming. Before we start going to those, I want to find out who is a good candidate for LASIK surgery?
Well, potentially anyone who needs to wear glasses or contacts to see. But you can't just look at a prescription and tell if somebody's a candidate. They really have to have a careful eye exam. There are also some tests that need to be performed to measure the thickness of the cornea, look at details of the shape of the cornea to see that structurally the eye is it would be a safe and effective procedure and fall within the parameters of what can be done.
Okay, good to know. So we've got the question from Christy, our first one, and it's, are there any risks associated with LASIK?
It's surgery. There are always risks, and the most common risk is just it wouldn't be perfect. And 94, 96% of the time, the target vision's achieved. But 3, 4, 5% of people may need an additional treatment or might have to have vision not quite as perfect as they'd hope. Biggest risk are infection, which fortunately is rare. We've been doing it since the mid-90s and still haven't had one, but they have occurred. There is what's called corneal ectasia, where the cornea shape becomes abnormal after LASIK, and a lot of the screening process is really to try and identify people who will be at risk for that. There are some side effects, dry eyes, glare, halos that can occur. And again, the evaluation process is to try and identify people who would be at increased risk for that.
Okay, good to know. Great question, Christy. Thank you for joining us. We've got one here from Mindy. And getting to this procedure, what are some things that someone should consider if they're looking at LASIK or PRK or some other vision surgery?
Consider how you use your eyes. if you wear your glasses all the time, wear your contacts, how they are a hassle or a headache for you. You know, you exercise and your glasses fall off, or your contacts irritate your eyes, you have bad allergies, and getting rid of those, would they improve your day-to-day functioning and quality of life? You also have to consider that when you're nearsighted, especially, how much you do close activity tasks without glasses or contacts. Because when we do LASIK and eliminate the nearsightedness, once you get in your 40s, you're going to start to need reading glasses, and in 50s, glasses for the computer, which I have to wear. So you have to, especially if you're in that age or close to it, you may have to consider that you're trading glasses for distance, the lack of needing glasses for close vision.
Okay. So when somebody has decided they're going to have LASIK surgery, do you do both eyes at the same time? Do you do one and then the other?
When we were in the FDA trials, we had to do one eye and then wait 6 months. People were miserable. So now 99% of the time, we'll do both eyes at the same sitting. It's much more convenient, minimizes time off from work and quality. And the results are so consistent, and the procedure is so safe that there's not any major reason to wait.
Okay.
No rule that you have to, though.
Okay. So what does the procedure look like in terms of timing? It sounds like it's a day surgery. You go in, you get it done, you go home.
Yes.
Yes.
It doesn't take long for the procedures. The lasers are very fast, and the actual laser time, the laser that we use to make a flap in LASIK, it takes 13 seconds for each treatment. And most treatments, the actual laser time is well under a minute. But the whole procedure probably runs about 30 minutes, because you have to, there's some prep that goes into it. You've got to do the flaps, one eye then the other, and then move over and do the laser treatment itself. And you have to, there's some draping and alignment and marking. So, but emphasize that you can't just take your contacts out and come in and have the procedure. It's very important that the measurements are going to accurately reflect the shape of your eye where you don't have contacts in. And so we have to always let those effects on your vision go away before we evaluate, and then not put them back in, because at the time of before surgery, so that the eye's in its pristine shape before we do surgery.
Okay, so it sounds like somebody needs to not wear their contacts for
ideally for soft lenses for 2 weeks, rigid lenses or torics for more like 3 weeks.
Okay, good to know. So what does recovery look like? If that's getting ready, what about recovery? That's a question from Carter.
Carter, that's a good question, and because for usually 2-3 hours afterwards, the eyes burn and sting, and then the vision's typically foggy, like looking through a fish tank. For the first 6-8 hours, and then it starts getting better each hour after that. And most people the next day are seeing well, many times better than 20/15 in each eye. But people will still say it looks a little foggy the first couple of days. First few days there can be some glare and halos, especially at night. But most people can resume normal activities, except we don't like people to swim for a month or so after surgery, just for the risk of infection.
That makes sense. So that actually gets to Amanda's question. Thank you for joining us. Amanda is asking, will you notice improvements in your vision immediately after the procedure?
A little bit of a lag, but generally within the first few hours or day. It works quickly. PRK, where we're not making a flap and we're just lasering on the surface, has more discomfort and initially, and it takes a little bit longer for the vision to clear or improve, but the end results are the same. It's just a little bit slower to get there. Occasionally, PRK is indicated for people whose eyes would be a candidate, but their corneas are a little bit too thin to safely make a flap and do the treatment. Or people that are in high contact activities like kickboxing and things like that. You don't want to getting kicked in the eye, especially, is never a good thing.
Yeah.
But immediately after LASIK could dislodge the flap and cause additional injury.
Good to know. Great question, Amanda. We're glad you joined us today. We are already about halfway through our chat, so get those questions coming in. If you've got more of them, they're great. You know, we're going to keep going here. You know, what is the success rate for LASIK? Is it 100%? Is it 90%? More than 50%?
Dealing with humans, nothing is 100%, but it's very, very close. And as I mentioned, 94, 96%, most of the results for people who are candidates for nearsightedness or nearsightedness with astigmatism. And then if you do additional treatment on those people once their eyes have stabilized in a few months, you're probably in the 99% range.
Wow.
And farsightedness is more difficult to treat, and that's probably a 75–80% success rate.
Okay, so we've got a question here from Jennifer. Thanks for joining us. And this is actually a question that I had. But what are some questions I should ask my LASIK surgeon?
All the things we've been talking about, but I would ask, you know, if he feels that you're a good candidate, that it would be safe for your eye. Is there anything in the screening processes that he sees that would make him concerned about doing the procedure? How long does he think you would be without glasses, either distance and near? How long does he think it will last in your eye? Would he anticipate? No one has a crystal ball, but based on other patients and experience, would he anticipate that you'd still be able to see 10 or 20 years from now?
Okay, and that's actually a perfect way to go to next question, which is from Christy. Do people have to get this procedure more than once?
Rarely.
Is it permanent?
Rarely. And we've got, gosh, if all the people that we've done over the past 25 years needed retreatment, I wouldn't have time to sit here and talk to you. So it's uncommon for people to change significantly. But I would say, looking at people now that are 20 years out from the procedure, around 10% of people, vision could be improved. They still see much better than they saw before they had LASIK, nowhere close to what their vision was.
Okay.
But I'd say about 10% of people vision can be improved with glasses or maybe potentially other additional treatment.
Okay, great question. These are great. We've got one here from Naz, and the person says that I have high power and a thinning retina. Do you think I could be a candidate for LASIK?
Usually not. When there are other issues with the eye, we see it in people, unfortunately, with macular degeneration, high myopia. Generally, if you're that nearsighted, you're going to be out of range for laser treatments. The laser is approved up to a -12, but most people, corneas are only going to not tolerate much more than a -8 treatment.
Okay, thank you so much for joining us, Naz. We appreciate the question. Now, you were talking a little bit ago about technology. You know, this has been around since the mid-90s now. How has technology for LASIK changed over the past couple decades?
Oh, you know, engineers are amazing people, and the lasers are faster, they're more precise. The advantage of it being faster is environmental conditions, which we control in the laser center, such as humidity, temperature, airflow, are become less important.
Okay.
The devices that allow the alignment of the procedure are much better. The tracking system's much more accurate and precise. The lasers now have the ability to do really fine, detailed corrections on the cornea. The wavefront guided treatments can adjust, which is a whole another talk, that what are called wavefront errors, that which are subtle sort of alterations in the way our eye focuses. Another laser can do what's called contoura cornea, which can actually normalize the shape of the surface of the cornea, give a better quality of vision. So it's night and day better and different than what it was back in the 90s, and people were very happy with it back then.
Yeah. No, there's definitely, you hear lots of people talking about this. And I've heard lots of people talking about laser surgery. So is LASIK a type of laser surgery, or are they different entities completely?
Well, LASIK is surgery with a laser. It's an excimer laser that has a unique ability to alter corneal tissue.
Okay.
And we can reshape it in a very fine, precise way based on the person's prescription. And there's surface laser, which is PRK. And if anybody says that they do flapless LASIK, a little bit of an oxymoron, that's a variation of PRK. And then LASIK is where we're doing, again, excimer laser treatment, but with the creation of a flap. So all of the refractive procedures in that sense are a laser procedure.
So are there age guidelines for LASIK? Is it something that, you know, a teenager could get, or somebody in their 80s?
There are minimum ages. You have to be at least 18, and your prescription should be stable. You don't want, if your eye is still changing, who knows what to target it. So you need to have a stable prescription for at least a year or two before considering it. Once you get into your 40s, the laser correction you have to think more about because of the need for reading glasses and the changes that occurred inside of our eye with our lens, not being able to adjust our focus as well. And occasionally people, if they don't understand that, will have LASIK to correct their distance vision, and then they'll be unhappy that now they have to put reading glasses on to see up close. As people get in their 60s and 70s, although it's used sometimes to fine-tune eyes after cataract surgery, once you getting in that age, most people are starting to get lens changes. Their prescription may start to change as the lens changes advance or they develop a cataract. So generally in that age group, it's usually better to wait and do lens replacement surgery, cataract surgery, rather than going with LASIK.
Okay, good to know. So we have a question from Diane that came in ahead of time, and she wasn't able to tune in. She was wondering if insurance typically pays for LASIK.
Unfortunately not. As most people have realized, the insurance companies try and cover as little as possible. And since there are alternatives for this procedure, that you can wear glasses or contacts, they consider it a cosmetic procedure and they won't pay for it. Now, occasionally if you have a vision plan that provides for eye exams, eyeglasses, and things like that, that money can be applied. The companies will allow that money to be applied towards laser surgery. some plans do have a benefit where they will pay a certain amount. You just really have to check with your carrier, but in most of the time,
It's not.
no.
Is it the same
So-
with Medicare?
Oh, Medicare, for sure,
Right.
no.
Okay. So noted, probably not with insurance, definitely not with Medicare.
Right, it's all an out-of-pocket expense.
Okay. So what advice do you give for people who are thinking, maybe I want to do LASIK, maybe I don't? What are some factors they should consider?
If you wear glasses or contacts all the time, then you could consider refractive surgery. It's just really what's best for you. If you find the glasses interfere with things that you like to do, people that go camping, people that are very active, a lot of people can't get sunglasses in their prescription and things like that. Many people would do surgery if they could comfortably wear contacts, but either because of the shape of their eye or allergies or other things, they can't tolerate them. So it's really a lifestyle choice. It's a very individual choice on what works best for you.
Okay, that sounds great. Well, I think we are all out of time. I know, Dr. Bowman, you've got to get back to clinic. I want to thank everybody for joining us today. Thank you, Dr. Bowman.
Oh, my pleasure, my pleasure. It's nice, thank you.
Very glad to hear it. Absolutely. So you will be able to check this chat out on YouTube later this afternoon. And of course, it'll still be here on Facebook. So if you have friends that missed it, please share it with them. In the meantime, have a great afternoon.